Hi, I'm Dr. David Hill, and today we're going to talk about how to diagnose infant jaundice. Jaundice refers to a yellow color to the eyes, the white of the eyes specifically, and the skin. And in infants, it can be a signifier of really dangerous disease. What is this disease? Well, when infants are born, they have more red blood cells than they're going to need outside the womb. They use these extra red blood cells to carry oxygen from mother's bloodstream into their own bloodstream. But once they're born, the red cells start to break down. One of the chemicals that they make as they break down is called bilirubin. Now, to have a little extra bilirubin is very, very normal. It's a normal part of a newborn. However, if the bilirubin level gets dangerously high, it can cross over into the tissue of the brain and cause permanent brain damage. So we're very, very careful about monitoring bilirubin levels in babies. Now, jaundice behaves in a very interesting way, and I don't think anybody knows why this happens, but the first place you see it is in the whites of the eyes. Then you see it in the face, then in the chest and the abdomen, and it moves all the way down the body, and when it gets better, it moves back up the body, and the last place you're going to see it is still in the whites of the eyes. If you notice that your baby looks yellow to you, please call that baby's doctor. There are labs that we can do to check the jaundice level, and without doing the labs, it's really very difficult to guess whether the jaundice level is appropriate or whether it's too high. There are all sorts of things that affect our perception of color, from our own genetic predisposition to see the color yellow, to the lighting in the surrounding room, the clothes, the color of the wall. All sorts of things can make a baby look more or less yellow. So without the lab, it can be very difficult to know whether your baby is too yellow or not. Be sure, if your baby was discharged from the hospital in the first 1 or 2 days of life, that you have a follow-up visit on day of life 3 or 4, because that's when babies are exceptionally vulnerable. Let your doctor know if you don't think your baby is feeding well, or if he or she doesn't seem to be gaining enough weight, because that's a risk factor. If your baby's premature, that's a risk factor. Or if there's another first-degree relative, you, dad, another sibling, who has had problems with jaundice and required treatment for it, then you need to be extra cautious about your baby. Your doctor will also look at some other things, whether your baby has any bruising, for example, on the head or the face that might make him or her more susceptible to jaundice. Now, jaundice is very easy to treat, and the treatment for it is amazingly successful. It just involves light and sometimes a little extra fluid either in the diet or as an IV. So, there's no reason any baby has to suffer permanent brain damage as a result of jaundice, as long as you and your baby's doctor are careful to look out for that condition. Talking about how to recognize jaundice in a newborn, I'm Dr. David Hill.